Welcome to another deep dive. Today we're tackling a topic that often gets whispered about more than talked about, STDs.
That's right.
And we're not just skimming the surface here.
Oh, no.
We dug deep into some recent articles and medical research,
We did.
and honestly, I was surprised by some of the things we found.
It's easy to get caught up in the myths and misinformation out there.
Right. So our goal today is to give you, the listener, a real in-depth understanding.
Not just a list of names.
Yeah. Causes, symptoms, the latest on prevention and treatment.
And, of course, why this all matters so much for your own health.
It can be easy to think, oh, STDs, that's something that happens to other people.
Right.
But the reality is STDs are incredibly common.
They are. The CDC estimates there are over 20 million new STD infections
20 million.
every year in the United States, and that number has been steadily increasing.
Wow. Okay, so that right there just shows how important it is to be informed.
Absolutely.
And to bust some of those myths. Like, I used to think if you don't have any symptoms, you're good. No STD, right?
And you'd be surprised how many people think that.
But that's just not true at all.
Nope. Many STDs can be completely symptomless.
Really.
Yeah.
So you could have an STD and not even know it.
Exactly. And still pass it on to others.
Okay, that's scary.
And these infections can lead to some serious long-term problems if they aren't treated.
Like what? What kinds of problems?
Well, it depends on the STD. Some can cause infertility.
Oh, wow.
Some increase your risk for certain cancers.
Cancers.
Yes. And even if you don't have noticeable symptoms, the infection can still be doing damage.
So even if you feel fine, it's important to get tested regularly.
Absolutely. It's the best way to catch things early when they're most treatable.
Okay, I'm starting to see how important this all is. So let's get into some specifics.
Okay.
You mentioned HPV earlier. I know it's pretty common,
It's the most common STD in the U.S.
but I don't really know much about it.
Well, HPV is actually a group of over 150 related viruses.
Wow, that's a lot.
And it's so common that almost everyone who's sexually active will get HPV at some point in their lives.
So pretty much everyone's had it.
In most cases, it goes away on its own and doesn't cause any problems.
Okay, that's good.
But some types of HPV can cause serious health issues.
Like those cancers you mentioned.
Yes, certain types of HPV can cause cancers of the cervix, vulva, vagina, penis, anus, and even the throat.
So it's not just a women's health issue then?
Not at all. Men can get HPV-related cancers too.
Wow. Okay, so what can people do to protect themselves?
There are two main things: vaccination and safe sex practices.
So the HPV vaccine, does that protect against all the types of HPV?
The vaccine protects against the types of HPV that are most likely to cause cancer and genital warts,
Okay, good to know. When's the best time to get the vaccine?
ideally before becoming sexually active.
And what about safe sex practices?
Using condoms consistently and correctly can help reduce the risk of getting HPV.
So it's about layers of protection.
Exactly. And it's important to remember that even though there's no cure for HPV,
Okay.
there are treatments for the health problems it can cause.
Like those precancerous cells you mentioned.
Yes, those can be treated before they develop into cancer.
That's reassuring. Okay, so HPV, definitely something to be aware of.
Absolutely.
And speaking of things to be aware of, HIV.
Right.
I feel like there's so much fear and stigma around HIV.
There is, and that's a shame because there have been so many advancements in treatment.
Okay, but first, just to clarify for anyone who's not sure,
Sure.
what exactly is HIV?
HIV stands for Human Immunodeficiency Virus. It's a virus that attacks the body's immune system.
That's the system that helps us fight off infections, right?
Exactly. And over time, HIV can weaken the immune system to the point where it can no longer fight off infections and diseases effectively.
And that's when it becomes AIDS?
Yes, AIDS stands for Acquired Immunodeficiency Syndrome.
Okay. And I know there's no cure, but you mentioned advancements in treatment.
Yes, antiretroviral therapy, or ART, is a combination of medications that can suppress the HIV virus.
So it stops the virus from replicating and causing more damage.
Exactly. And with consistent use of RT, people with HIV can live long and healthy lives.
That's amazing. So it's not a death sentence anymore.
Not at all. Early diagnosis and treatment are key.
Makes sense. Okay, so we've talked about two viral STDs,
Right.
HPV and HIV.
Mm-hmm.
Now, what about bacterial STDs?
Well, those are caused by bacteria, as the name suggests.
Okay, and how are they different from viral STDs?
Well, the main difference is in how they're treated. Bacterial STDs can usually be cured with antibiotics.
Oh, that's good. What are some common bacterial STDs?
Two of the most common are chlamydia and gonorrhea.
Oh, yeah, I've heard of those. What are the symptoms?
It can be tricky because often there aren't any, especially in women.
So you could have it and not know it.
Exactly. But if left untreated, they can lead to serious complications.
Like what?
Well, for women, it can lead to pelvic inflammatory disease or PID.
PID.
Yes, that's an infection of the female reproductive organs.
And what does that mean? What happens?
It can cause chronic pelvic pain, make it difficult to get pregnant, and even lead to ectopic pregnancy.
That's when the pregnancy happens outside the uterus, right?
Yes, and that can be life-threatening.
Wow. So these are definitely not things to mess around with.
You got it. And for men, untreated chlamydia and gonorrhea can cause problems too.
Okay, like what?
Things like inflammation of the tube that carries sperm or the
Ex-
prostate gland.
So even though they're bacterial, they can still have lasting effects.
Absolutely.
Yeah.
Which is why getting tested is so important.
So you can get treated early.
Exactly.
Okay, well that makes me feel a little better knowing that chlamydia and gonorrhea can be cured.
Yes, with antibiotics.
Right.
But remember, early detection is key.
Right, because the longer you wait, the more damage it can do.
Exactly. And there's a whole range of other STDs out there besides these few that we've talked about.
Really? Okay, so we've got viral STDs like HPV and HIV, and bacterial STDs like chlamydia and gonorrhea.
Mm-hmm.
What other kinds are there?
Well, next, I think we should talk about some of the lesser-known STDs like pubic lice.
Cubic lice. Can we maybe skip that one? I'm not sure I'm ready for that conversation.
Okay, we can come back to that one.
Yeah.
But it just goes to show that the world of STDs is more diverse than many people realize. And it's not just bacteria and viruses that cause them.
Really? What else?
Well, there are STDs caused by parasites, like trichomoniasis.
Trichomoniasis. What's that?
It's a very common STD,
Mm-hmm.
and like many others, it can be symptomless.
So again, you might not even know you have it.
Exactly. And another important point is that our understanding of STDs is constantly evolving.
Okay, what do you mean?
Well, there are some STDs that are relatively new, like Mycoplasma genitalium or MG,
MG, I've never even heard of that.
and there are probably others out there that we haven't even discovered yet.
Wow, so we're constantly learning new things.
We are. And that just reinforces how important it is to stay informed and to talk to your doctor if you have any concerns.
Okay, so lots to think about there. We've covered the basics of viral and bacterial STDs and even hinted at some of the lesser-known ones.
And we've talked about why getting tested is so important.
Right, even if you think you're fine. But what about treatment?
We'll get into that in more detail in our next segment. But for now, remember that most STDs are treatable, especially when caught early.
That's good to know.
And it's important to remember that not everything that affects the genitals is an STD.
Oh, interesting. What do you mean?
Well, for example, bacterial vaginosis, or BV, is often mistaken for an STD.
I've heard of BV. It causes that fishy odor, right?
Sometimes, but not always. And importantly, it's not caused by an infection that you get from someone else.
Oh, so it's not contagious.
Right. It's just an imbalance of the bacteria that are normally present in the vagina.
Okay, so that's important to know. It's not something you catch from a partner.
Exactly. But it can still cause symptoms and needs to be treated.
So if you're not sure what you're dealing with, it's always best to talk to a doctor.
Absolutely. They can help you figure out what's going on and recommend the best course of treatment.
This has been a really eye-opening conversation. I feel like I'm finally starting to understand the complexities of STDs.
A big topic, but I'm glad we could shed some light on it.
Me too. And for our listeners, I hope this has been informative and empowering.
Absolutely. Knowledge is power when it comes to sexual health.
We'll be back with part 2 of our deep dive into STDs, where we'll discuss treatment options, prevention strategies, and the emotional side of an STD diagnosis.
So stay tuned for more. So we've talked a lot about different types of STDs, but now I think it's time to really focus on what you can do to protect yourself.
Yeah, good point. We've mentioned testing a few times,
Right.
but I think it's worth spending some time talking about it in detail.
Absolutely.
Because even though we all know we should get tested, it can be kind of scary, to be honest.
It can. There's a lot of anxiety around it for some people.
Yeah, like what if the test hurts, or what if it comes back positive?
Exactly. And there's often a lot of shame and stigma associated with STDs,
Right, like you've done something wrong if you have one.
which is so not true. But that stigma can make people afraid to get tested.
Yeah, I get it. So let's break it down. What can someone actually expect when they go for an STD test?
First of all, it's important to know that you have options. You can get tested at your doctor's office, a local health clinic, or even some community centers.
Okay, so lots of places to go.
And many clinics offer free or low-cost testing.
That's good to know.
And there are often options for confidential testing as well.
Okay, so you don't have to worry about your privacy being violated.
Exactly. As for the tests themselves, it really depends on what STDs they're looking for.
Oh, so it's not just one test for everything.
No, there are different tests for different STDs. Some involve a urine sample.
Okay.
Some involve a swab.
Like a Q-tip.
Yeah, kind of. And sometimes they'll do a blood test.
Okay, so it varies depending on what they're testing for.
Exactly. And your healthcare provider will be able to tell you exactly what to expect.
Okay, that makes sense. And once you've taken the test, how long do you have to wait to get the result?
It depends on the type of test and the lab, but usually it's a few days to a week.
A week? That seems like a long time to wait.
Yeah, I know.
Uh,
But some clinics offer rapid testing for certain STDs, which can give you results in as little as 20 minutes.
20 minutes. Wow, that's fast.
It is. But even if you have to wait a week, it's important to remember that getting tested is a really important step in taking care of your health.
True. So let's talk about the elephant in the room. What happens if you get tested and it comes back positive?
Well, first of all, it's important to remember that a positive STD test is not the end of the world.
Okay, that's good to hear.
Most STDs are treatable, especially when caught early.
So it's really important to get tested regularly so you can catch things early.
Exactly. And your healthcare provider will be able to walk you through the treatment options.
Okay, so it's all about working with your doctor to figure out the best plan.
Exactly. And the treatment will depend on what STD you have.
Makes sense. So like what would the treatment be for something like chlamydia?
Chlamydia is a bacterial STD, so it's usually treated with antibiotics.
Antibiotics, okay.
Gonorrhea and syphilis are also bacterial STDs that are treated with antibiotics.
Got it.
And it's really important to take all of the antibiotics as prescribed, even if you start feeling better before you finish them all.
Oh yeah, I've heard that before. Why is it so important?
Because if you don't finish the whole course of antibiotics, the infection might not be completely gone,
Oh,
and it could come back even stronger.
and possibly be resistant to the antibiotics.
That's right.
Okay. So always finish your antibiotics.
Always. Now, for viral STDs like HIV, herpes, and HPV,
Mm-hmm.
it's a little different. There's no cure for these viruses,
Okay.
but there are medications that can help manage the symptoms and prevent complications.
So even though they aren't curable, they're manageable.
Exactly. And for HIV, there's antiretroviral therapy, or RT.
We talked about that earlier.
Right. RT can suppress the virus to the point where it's undetectable in the blood.
So the person can't transmit the virus to others.
That's right. And they can live a long, healthy life.
That's amazing.
It really is.
Mm.
And there are medications for herpes that can help prevent or shorten outbreaks,
Okay.
and treatments for precancerous lesions caused by HPV.
So even though there's no cure, there's still a lot that can be done.
Absolutely. And it's not just about the physical treatment.
Oh, right. Getting diagnosed with an STD can be a really emotional experience.
It can.
Yeah.
And a lot of people feel ashamed or guilty or scared.
Yeah, I can imagine.
And that's why it's so important to remember that you're not alone.
Okay.
There are healthcare providers who are trained to support you, both medically and emotionally.
That's good to know.
And there are support groups and hotlines and online resources that can provide information and a sense of community.
So you don't have to go through this alone.
Exactly. And I know we've said it before, but it's worth repeating. Prevention is always the best approach.
Yes, absolutely. But besides condoms and vaccination, what else can people do to prevent STDs?
One of the most important things is to have open and honest communication with your partner.
About sexual history.
Yeah. Talk about your past, get tested together, and make informed decisions about what you're comfortable with.
Communication is key in any relationship.
Absolutely. And limiting your number of sexual partners can also reduce your risk.
That makes sense. What about like showering before and after sex? Does that help?
Practicing good hygiene can definitely help reduce the risk of bacterial infections.
Okay, so it's not just about preventing STDs, it's also about general hygiene.
Exactly. And of course, this might seem obvious, but avoid sexual contact with someone you know has an STD.
Right, don't take unnecessary risks.
Exactly. It's all about being informed, making responsible choices, and prioritizing your health and the health of your partner.
Well said. So we've covered testing, treatment, and prevention. I'm kind of curious to hear your thoughts on the bigger picture of STDs, like their impact on society and culture.
That's a great question and a perfect segue into our next topic.
Yeah, it's interesting to think about STDs from that bigger
It
perspective.
is,
Like, it's not just about individual health.
right?
It's also about how these infections kind of, I don't know, intertwine with our beliefs and behaviors and history.
Absolutely. I
Mm.
mean, STDs have been around for centuries, and their impact on society has been pretty profound.
Yeah, and it seems like they've always been surrounded by so much like stigma and secrecy,
Oh, absolutely. For a long time, they were seen as something shameful,
mm,
something to be hidden.
which probably made people even less likely to talk about them or get tested or treated.
Exactly. And that just perpetuates the cycle of stigma and misinformation.
So how do we break that cycle? How do we change the way we think and talk about STDs?
Well, I think education is a big part of it.
Right, the more we know.
The less we fear.
Yeah, exactly. If we understand the facts, we're less likely to judge or discriminate against people who have STDs.
Exactly. And we need to be having open and honest conversations about sexual health.
But those conversations can be hard.
They can be.
Yeah.
But they're so important. We need to create a culture where people feel comfortable talking about these things without feeling ashamed or embarrassed.
Yeah, like it's no big deal to talk to your doctor about getting tested. Yeah.
Exactly. And it's not just about individual conversations.
Hmm.
We need to be talking about STDs more openly in the media, in schools, in our communities.
That becomes more normalized, less taboo.
Exactly. Because at the end of the day, STDs are a health issue, not a moral one.
Right. It's not about being good or bad. It's about taking care of yourself and your partners.
Exactly. And when we approach STDs from a public health perspective,
Okay.
we can focus on prevention, testing, and treatment without all that judgment and shame.
Yeah, that makes a lot of sense. So, besides education and open communication, what else can we do on a societal level to address this issue,
Well, I think it's crucial that everyone has access to affordable, quality healthcare.
including STD testing and treatment?
Absolutely. Everyone should be able to get tested and treated without facing financial barriers.
Right, and that's especially important for marginalized communities who might already face challenges accessing healthcare,
Exactly. We also need to continue investing in research to find new and better ways to prevent and treat STDs.
like developing new vaccines.
Yes, vaccines are a powerful tool for prevention. But we also need to find new treatments, especially for those STDs that are becoming resistant to existing antibiotics.
That's a scary thought, antibiotic resistance.
It is, and I think it's really important to remember that STDs are not just a medical issue. They can have a huge impact on people's lives.
Right, like their relationships and their emotional well-being.
Exactly. So we need to approach this issue with compassion and understanding.
Definitely. And we should also celebrate the strength and resilience of people living with STDs.
Yes. There are so many people out there living full and happy lives despite their diagnosis. They're advocating for others, educating others, and showing that it's possible to thrive even with an STD.
I love that. So much of this conversation has been about knowledge is power, and I think that's such a perfect note to end on.
It is. Knowledge can help us overcome fear, stigma, and shame. It can help us make informed decisions about our sexual health.
And it can help us create a world where STDs are no longer seen as something to be whispered about, but as a health issue that we can openly discuss and address.
I couldn't have said it better myself.
Well, that wraps up our deep dive into the world of STDs. We've covered a lot of ground today, from the different types of STDs and their symptoms, to prevention, testing, and treatment options, to the social and cultural implications of this often misunderstood topic. I want to thank you, the listener, for joining us on this journey, and I hope you walk away feeling more informed, empowered, and hopeful about your own sexual health.